Thanks for tuning in to NCE Prep with Portia, Part 7, Professional Counseling Orientation and Ethical Practice. Some parts of this video are repeated from the first ethics video, but that's just how the exam is set up. That's why you see ethics questions throughout the entire exam, no matter which version you take. History of the counseling profession. Know these major figures and their contributions and theories. Frank Parsons, father of vocational guidance. Carl Rogers, person-centered therapy, unconditional positive regard. Sigmund Freud, psychoanalysis. Aaron Beck, cognitive therapy. Albert Ellis, rational emotive behavior therapy. You may come across historical movement questions, so familiarize yourself with those as well. Counselor professional roles. You must understand what counselors do professionally. Roles include counselor or therapist, advocate, consultant, educator, supervisor, or researcher. Counselors may work in schools, mental health clinic, hospitals, private practice, or community agencies. Please know the difference between professions. Know what a psychologist does, what a social worker does, what a psychiatrist and a counselor does as well. Sometimes counselors and social workers could do the same thing, but what's the main thing a social worker can do? What's the main thing a counselor can do? And so forth and so on. The ACA Code of Ethics. Listed here is major sections of the Code of Ethics. You should know everything that there is to know when it comes to ethics, but for exam purposes, focus on these sections. Confidentiality and its limits. Confidentiality must be broken when there is danger to self, danger to others, abuse of child, elder, or vulnerable adult, or if there is a court order. When you see this, automatically think the legal case of Tarasoff versus Regents of the University of California. This case established counselors must warn the intended victim, notify authorities, and take reasonable steps to protect the victim. When it comes to informed consent, clients must understand counseling process, risk and benefits, confidentiality limits, fees, and counselor qualifications. The informed consent should be written, explained verbally, and ongoing. Dual relationships and boundaries. A dual relationship occurs when counselors have another relationship with the client. Examples are y'all are friends, you have a business relationship, there's a family member, or social media contact. Modern counseling ethics include telehealth, online counseling, social media boundaries, and electronic records security. Counselor self-care, important. Ethical responsibility includes preventing burnout, recognizing impairment, and seeking support when needed. Know when to seek treatment, reduce your workload, and suspend practice if necessary. Ethical decision-making model. Know how to solve ethical dilemmas. Common steps will be identify the problem, apply ethical codes, colleagues, consider laws, evaluate possible actions, choose best option, and document your decision. If you don't document it, it never happened. Here's a cheat sheet for a quick reference. Everything listed below is mainly what you should focus on for this section. As always, thanks for watching, and I'll see you in Part 8.